Hello, Dr. Masoodi. Good afternoon.
Yes.
Hi, how are you doing
Hi.
today? Is everything going great for you? Okay, that's wonderful.
Thank you.
It's such a nice background on your back. You're welcome. Thank you. So, Dr. Masoodi, I'm just gonna introduce your like what you have been doing up till now, so then we can go on from there. Okay. So guys, we have our honorable guest, Dr. Massoudi, who is the founder and CEO of Masoodi Foundation, as well as a board certified neurosurgeon and practices in California. He is also the CEO of Masoodi Foundation, which is going to be helping the international medical graduate to transition into the American healthcare system. So welcome to our channel,
Thank you
Dr.
for having me.
Massoudi. Well,
Delighted.
we are glad that we have you. You're welcome. So, Dr. Masoodi, today we wanted to discuss about how do you think Masoodi Foundation can be a valuable asset to all the people who are
So
applying for
today,
the residency, and
the
how
Massoudi
you will be able to
Foundation is
help
a
the
young
students.
foundation. It's a family foundation. My wife and I really formed this foundation out of our dedication and commitment to enhancing and optimizing the opportunities for scientists and women and men who are pursuing graduate careers in scientific pursuits and medicine and wanting to get residency training positions in the United States of America. We strongly believe that every smart, hardworking, disciplined man and woman out there deserves the best opportunity to be able to access the huge opportunities and potentials that the United States of America and this great country have to offer to folks to pursue their educational objectives and to become really meaningful contributors to the enhancement of humanity in the years and decades to come.
Oh, that's awesome, Dr. Masoodi. So I was just also figuring out, for example, you recently launched the new research fellowship, and also the people who are going to be doing the research fellowship, either virtual or either on site, will also be getting the hands-on opportunity to shadow you all the people who wants to pursue neurosurgery or neurology, and there are also more folks
Yes.
who could
So
join the
our
internal
goal
medicine as well
in
as pediatrics,
setting
right?
up the Massoudi Foundation Fellowship Program is entirely based on our desire to be able to afford the opportunity and the potential for men and women who are seeking graduate learning opportunities and residency training programs in the U.S. So to that end, we have devised and formed this fellowship program that consists of two distinct parts. One is the fellowship's ability and means to educate men and women in the arena of writing scientific papers and engaging in scientific work and scientific research. So there's that whole aspect of the education of our fellows when it comes to the proper techniques of scientific pursuit and writing research papers. And we have a number of very accomplished and capable PhD participants in our program that will be leading the charge and educating our fellows with respect to the skill set that they need to really engage in scientific pursuits and scientific research. The other aspect of the fellowship program is a hands-on clinical shadowing program where the fellows get to really shadow and follow neurosurgeons, pediatricians, and internal medicine specialists in their daily practices. Firsthand learn about what it is to be an internal medicine specialist, a pediatrician, or a neurosurgeon in terms of the goings on of the office, how the patients are evaluated, how the patients are followed, how diagnostic tests are ordered, and how the treatment is rendered. And specialties, at this point in time, neurosurgery, the fellows will be able to shadow the neurosurgeon which at this time is primarily myself, in the operating room and in the hospital to get to see, observe, learn the surgical procedures and how patients are taken care of in the surgical arena.
Yeah, that's awesome, Dr. Massoudi, because these days there are many hospitals and many outpatient and inpatient offices which do not allow the students and people, the students who are not present in the US, physically, they are having so many difficulties. Like it's, first of all, they have to go through the visa process, and that's extremely challenging. And but later on, they have been charged like a couple of $1,000s to just do a single rotation. So like our goal with this IMG Helping Hands and the Curie Research Foundation was to reduce the cost price of all the services, which so that international medical graduates could like avail all the services at a
Right.
less cost.
And one of the big motivations
I
and the impetus behind forming the Masoodi Foundation is to really provide the men and women who seek access to and want to gain access to graduate medical education in the United States of America. We know this has been a challenge in the past from a perspective of international students, and we'd love to be able to be in a position to help as much as we can to provide that access to graduate medical education, graduate research education in the U.S.
That's great. And I also like the idea about getting both type of experiences, like outpatient and inpatient. As you mentioned, the people who are going to be shadowing you or other both certified internal medicine as well as pediatricians, the students will be working in both type of settings, outpatient as well as inpatient. Because when they apply in residency programs, it's very competitive these days, and the hospitals require that the students should have experience in both type of settings, outpatient and inpatient, and then get a like great letter of recommendations as well. So this is also something which you are going to be giving them. Like,
you're absolutely right, and you are correct in everything you just mentioned. So ultimately, the recognition that the fellow will receive from the Masoodi Foundation in the context of the clinical shadow program, whether it's in the outpatient setting and also in the inpatient operating room setting, is a letter of recommendation from the Masoodi Foundation, which hopefully would augment and optimize the likelihood of the fellow gaining acceptance into a medical graduate program, as we discussed.
Okay, that's great, I guess, because we get so many requests from the residents, like the people who are doing residency here in the States in the few specialties, because sometimes they do have to get a little bit training in the research and do research publications in different journals. And unfortunately, some areas do not provide the opportunity. So this is something
the Masoodi Foundation prides itself in having developed a network of relationships with scientific researchers and scientists across the globe. And the fellow that is accepted into the Masoodi Foundation program will have access to the appropriate venues and channels such that in that manner and method, the fellow can connect with the particular and appropriate researcher, scientist, and really at the end of the day, participate in a meaningful scientific pursuit that results in a paper publication.
Oh, that's great. So I guess this opportunity will not be just limited towards the medical students or graduates, but if any resident who wants to get research publications, he can also join and just shadow or do electives right now. So I know that we get so many requests from all over the world, like for the students, they're really confused about electives and like observerships or externships. So just wanted to elaborate that by electives, we mean that we will be providing opportunity in the, like by collaborating Masoodi Foundation. The electives, the difference between the electives and the externship is just that you can do electives before graduation.
Absolutely. So there are many different ways to describe this. Really, the opportunity, the fellowship with the Masoodi Foundation, with the elements that we described, really constitutes the externship for the applicant, for the fellow. And in addition to that, if the fellow wants to really pursue a specific objective within a specific laboratory, we will do our best to connect that fellow with the appropriate researcher, laboratory, institution, such that an elective in research pursuits can be formed and really customized based on the needs and the aspirations and the goals of the fellow, in pairing that fellow up with the particular lab that is appropriate for his or her needs.
Oh, that sounds great. I guess there will be many people. We already got a request from so many candidates, but we were still figuring out the structure. Like I was about to discuss everything with you, and we're gonna be involving all those fellows with our organizations. Yeah, that's I guess one of the best thing which we can do. And also related to cost, what do you think will be how we are able to do this every, like
so
for example,
the
fellowship
cost is,
in less cost
is
without
something that
compromising
is
the
yet to be
quality?
determined specifically, but the cost associated with the fellowship is really the money and funding that goes into covering the administrative costs of running the fellowship program. And it can be customized such that it would be really involving the research application and research pursuits of a fellow, and also the clinical shadowing program. But really the cost is going to be very low and very reasonable, and the cost of the fellowship program is to cover our administrative costs and allow us to survive and thrive and grow such that we can help more and more of the fellows around the world.
Yeah, that's true. And also some of the fellows like who are interested in doing just the virtual fellowship or the virtual hands-on, not hands-on, like the virtual rotation, is it also a possibility? For example, they can shadow you or get a virtual
digital
shadowing
platform
while you're working.
It's actually the name of it is Steer Health, that allows us to engage the fellows and put them in contact with the researchers and physicians and clinicians in a virtual way. It is really a groundbreaking digital engagement platform. And yes, so the fellows can engage remotely and virtually in the shadowing pursuits and clinical activities that we just described.
Go. I think that's great. So meanwhile, we are having a discussion about our fellowship program as well as the hands-on rotation program. I will also provide the opportunity to the students who could join us, and if they want to ask any question, they're welcome. Please drop your question in the chat and we'll be happy to answer. Yeah, so I'm just waiting for a question from, yeah, but I can share one question which I received recently from one of the candidates. He was asking about how do we have to do any documentation? Like, for example, if we are doing any hands-on rotation with the view. So
in our fellowship program, the documentation and the paperwork, if you will, is already determined. There are set templates, and the applicant, the fellow, will be introduced and become very familiar with the process that we have put into place. The paperwork and the application and the documentation of the activities are quite straightforward and simple, but that will be shared with the fellow right up front before the start of the program. The fellowship is envisioned to be a month-long fellowship, and it can be extended based on the particular needs and aspirations of the particular applicant and fellow. And along the way and upon the completion of the fellowship, the documentation will be provided such that it can be retrieved and accessed and reviewed by all reviewing entities, including the graduate medical programs and research institutes where the applicant is applying to.
Got it. Okay. So is there also, for example, do they need any
No,
malpractice
they do
insurance?
not.
Do they have to buy
The
if they're doing hands-on rotation in the California?
position,
Oh,
and
okay,
they do not have
that's
to buy
feasible, I
any
guess.
extra insurance protection or coverage.
Oh, okay, that's great, I guess. So I have received another question. The FOC is saying for hands-on,
Yes,
how to apply, and
everybody can
can
apply.
USMLE
We
aspirants
are
can apply?
working on really consolidating and simplifying our means of applying to the Masoodi Foundation Fellowship Program. And with your help and the great participation of your organization, IMG Helping Hands, we're going to have a very simple, unified front and approach and application process for fellowship applications and for the fellows to apply to our program.
Yeah. Oh, I guess that's wonderful. I guess all we could do is just assist our fellows who are from all over the world, so they could get hands-on opportunity as well as the research. And also, I believe, for example, if any person who is going somewhere else to do a hands-on rotation, it's just a hands-on. But if they are being involved with Masoodi Foundation, and they're also getting the research opportunity, because right now what I have been told from a few programs is that having no research is a red flag, which wasn't the case like a few years ago. But now, since everything is related to research, the people should
Dr. Zen,
have
you're
at least
absolutely
like 4 or
correct.
5 publications
The
to
level of
apply
competition
to
is
residency
rising and
programs.
entering into medical graduate programs. And the Masoodi Foundation, through its vast network of researchers and PhD workers and great scientists, can afford and allow the opportunity for the fellows to get connected with the folks that are actually doing the research and scientific pursuit and get their names on at least one publication, and depending on their level of interest and motivation, even more.
Okay, that's great. I got another question here. One of the focus saying that how, for example, if I apply today or tomorrow,
The
like how
application
early can I
screening
be?
process, which
Can I start
sometimes
this
also involves
hands-on
a
rotation?
phone interview between the applicant and myself, takes about 3 weeks. So if you apply now, most likely you will get started with your fellowship program February 1st. It's a month-long process to kind of, yes.
Yeah, that's true. It can take
Yeah.
at least a month to just review the application and conduct the phone interview.
Yes.
So yes, guys, it's gonna take at least a month if you apply today. So let me see if we have another question. Yeah, so I have received another question, which is, if we are doing hands-on rotation with Dr. Masoodi, what if we don't want to do more than one rotation? Like we also want to
That
work with
is,
internal medicine
in
physician
short,
or pediatrics.
that is a
Is it
possibility.
a possibility?
Our fellowship program is designed to be flexible and customizable. And if a particular fellow, after spending a month, wishes to pursue other additional interest in clinical shadowing of another type of practitioner, which at this present time, in addition to neurosurgery, we're talking about pediatricians and internal medicine specialists, that is definitely an opportunity that can be explored and can be offered to the fellows.
Oh, that sounds great. And also, I have comprehended that if any person who is doing research fellowship as well as hands-on rotation, he will be getting the both certificates that he has completed research fellowship with Masoodi Foundation as well as the hands-on rotation with you or with any
Yes.
physician. Like,
So the fellow, upon the completion of a month-long fellowship, in either clinical shadowing or research education, will receive a Masoodi Foundation issued certification that he or she completed successfully that particular program that we were talking about.
Oh, that sounds great. Thank you so much, Dr. Masoodi. I guess we don't have any more questions right now, but if there are any other questions, you guys can just send us and then we will be happy to answer. And we appreciate your time. support all you have
Dr.
been
Zain,
doing for the
I'm so
international medical
excited to be in a
graduates as well
position
as
to help in
medical
any
graduates here
way
in the US.
possible our aspiring young men and women who want to pursue educational careers and clinical careers in medicine and scientific research in the United States of America.
Oh, okay, that sounds great.
Thank
Well,
you.
thank you so much, and I guess have a great rest of the day. Enjoy your vacation. You're welcome. Thank you.